All right, good morning, Canada. This is a story that we've been following here at Your Morning and at CTV News for a while now. I'm talking about the opioid crisis that has claimed a number of lives in recent years. And now a new report from Toronto Public Health is recommending decriminalization of all drugs for personal use in its attempt to reduce opioid-related deaths and overdoses. So right now with me is AM and Kels. Before we get to this report, we'd love to know and hear, how do you feel about this?
Well, we've had a few segments on this show already. We've looked at the Portugal model, for example. And we've talked about how this could alleviate some of the deaths. I mean, we've seen numbers that we've never seen in this country before. It has reached a crisis stage. Last year we had Toronto's mayor looking for answers, looking for solutions, because they didn't want to hit the levels that we had already seen happening in BC. And we've heard the cry from healthcare workers saying we need to do something.
Yeah, we need to do something. That's the thing, right? Whether this is the answer, I don't know. But obviously what is in place isn't working. And criminalization of drug use forces people into unsafe environments to do the drugs, which is hugely concerning. So what we need to do, I don't know. I'm interested to hear some of the stats, though, to see if this is the next move.
Well, let's get into the report and see what it says, because the report is based on dozens of interviews with people who use drugs, their friends, family, and the community, as well as independent research. So here's what it found. Criminalization leads to drug users being forced into high-risk behaviors to avoid detection, such as sharing needles, for example, and we know what can come with that, such as diseases and infections. But also, the report showed that the proliferation of the violent illegal drug market and billions of dollars in police, courts, and prison costs by enforcing drug laws. So there is a community impact, a social impact that does come with criminalization. At the end of the day, though, people on the other side of the spectrum do say that it is illegal. And if it's illegal, don't do drugs. But sometimes we know that addiction is real. It is a mental health issue. So people do find themselves in that circumstance. I do want to look at the numbers, though, for opioid-related deaths, overdoses, because we have seen them increase year over year at a dramatic pace. So take a look here. This from Stats Canada. Last year alone, nearly 4,000 people lost their lives to opioid overdose. You can see the majority of the problem high in BC. It has moved east, Ontario right behind. It's also really affecting Alberta. But now we're also starting to see that problem move into Quebec and the Maritimes as well. So what are politicians doing? I mean, we talked about some of the stuff that we've seen in BC, also implemented in other provinces in the prairies, Ontario, for example. One of those has been equipping police forces with naloxone kits. We're seeing this at many music festivals as well. And what that helps with is that if somebody does overdose and emergency crews are able to get to them in time, you could potentially save people's lives. But sometimes you can't get to people in time. So what some cities have done, like Vancouver and Toronto, is that they've implemented safe injection sites. And what these places are where people who do, I guess, want to shoot up in a sense, they can go to a safe spot that is manned by health professionals, and so you don't have the risk of people sharing needles or getting drugs that could be laced with fentanyl, for example. But not everybody's in agreement with this. I mean, it is a very controversial issue. I mean, we've seen in Vancouver, these safe injection sites have spread in the terms that it's being supported there. But here in Toronto, we recently just had a new provincial government come into power, a PC government, and Premier Doug Ford is strongly opposed to this. In fact, he says he would not like to see these safe injection sites in Toronto. Rather, he would like the province to focus on rehabilitation and has pledged nearly $2 billion for mental health and addiction services. So we could potentially see those these trial safe injection sites in Toronto be disbanded, and taken away. Is that something people want to see? I'm not sure. But AM, you talked about the Portugal model. This is what many advocates point to. And what many people don't know is that in the 80s into the 90s, Portugal went through a heroin addiction outbreak where people right across the country were overdosing and they were seeing high spikes in deaths. What they decided to do was decriminalize drugs. And I want to get this right. People can have the equivalent of an up to 10-day individual supply of drugs without being charged. In 2012, 16 people died from overdoses. Take into account in Canada, we saw nearly 4,000 people die from opioid overdoses.
Big change.
So it is a model that potentially Canada can move towards, but it is something that Canadians across this country would have to support. So Canada, here's your #YourTake question. Opioid crisis. Should Canada decriminalize all drugs for personal use? Let us know on social media right now.